Today we're continuing our Rare Liver Disease Week, and today the subject that we're going to discuss is autoimmune hepatitis. We have here with us today Dr. Savvas Milios. He's a doctor living in Cyprus today, born in Limassol, and he studied medicine in Italy, where he graduated with his medical degree. He then moved to Greece and decided what his specialty was going to be, and moved back to Cyprus later on, where he started his private business. Today, he's working and also volunteering in the Liver Patients Organization as vice president in Cyprus today. Now, besides that, we have here a doctor who has a chronic liver disease, chronic autoimmune hepatitis, and I'd like to see him here today, and I'd like to ask him some questions about how he's living. And here we are. Let's start now. Savvas, I'd like to ask you, first of all, I hope I'm pronouncing your name correctly. I never know if I am or
It's
not.
okay. It's very okay, Savvas. I would like to thank you very much for your kind invitation to this interview, but also by providing me with stimulating questions and giving me the opportunity to open up.
Okay, I think it's very important because we're very happy to have you as part of our working group for rare diseases also as well. I think somebody that has personal experience, that's the best thing to get things moving and to get people help. This is what we need. Anyway, you're a medical doctor, you're a liver patient, and you're a patient advocate. How do you keep the three experiences together? How does one influence the other one? Can you tell me a little bit about those things, how you manage to balance things out?
Yes, you are absolutely right. I'm a medical doctor who then became a liver patient, who then became a patient advocate. Like all doctors, I spent a respectful number of years in medical school, followed by specialization in residency programs, followed by years of to stay up to date with scientific research and medical developments while working with patients. It is true that medical schools equip us with the knowledge and skills required to understand pathologies, diagnose them, and treat them. Through this journey, our number one priority is our patients and their well-being. What we tend to miss, however, on the way and this is where life comes in to remind us when required, is that at the end of the day, doctors are human beings as well. And as with all human beings, they get ill. We can get ill with a range of clinical conditions, either acute or chronic. So in my case, when I became diagnosed with my chronic liver condition, I found myself sitting across the other end of the desk, seeking advice and medical care from colleagues. The whole experience has been humbling, to say the least.
But you were diagnosed with autoimmune hepatitis, correct?
Sorry?
You were diagnosed with autoimmune hepatitis.
Autoimmune hepatitis, exactly.
Yes. How did that impact your being a medical doctor?
Yes, I tell you. So in my case, when I became diagnosed with my chronic liver condition, I found as I was telling before, I found myself sitting across the other end of the desk, seeking advice and medical care from colleagues. The whole experience has been humbling, to say the least, and you realize that as all patients do, your health is your most valuable asset, and losing that for whatever reason makes you feel really insecure. Through my own experience, I have now gained a deeper understanding of what it's like to be on the receiving end of the medical care. It has also provided me with insights of things that can be improved in the patient journey, including aspects of care such as diagnosis, referrals, follow-up, need to travel abroad for liver transplants, for management, or even for consultations. Our liver patient organization here in Cyprus, it's called Prometheus, and ELPA, gave me the opportunity to combine my experiences of both being a doctor and a liver patient into a patient advocacy role where I strive to use my experiences as an aid to other people out there who are undergoing similar experiences. And I will briefly describe this patient advocacy role as promoting patient safety and quality care by protecting patients, most important, giving voice to the patients, educating the patients, improving the doctor-patient relationship, and building awareness about the problem.
In your point of view, what is a challenge for a person with a rare liver disease? What are you facing with that? What do you think that, how would you describe it?
Yes, okay. At this point, I would like to clarify what we mean when we talk about rare disease. What is a rare disease? According to the statement of the European Commission of Public Health, rare diseases are a group of life-threatening or chronically debilitating diseases which present with a low prevalence. So in this term, epidemiological criteria are essential for their definition. In Europe, a disease whose prevalence is lower than 1 in 2,000 people is considered a rare disease. And liver involvement is prevalent in many rare diseases. Regarding liver pathology, there are many different types of rare liver diseases, each one with its own unique characteristics and symptoms. To name a few, it's autoimmune hepatitis, it's primary sclerosing cholangitis, it's primary biliary cholangitis, Wilson's disease, alpha-1 antitrypsin deficiency, and many others. So rare liver diseases are very important for us for several reasons, and they pose serious challenges. Among the challenges faced by patients with rare diseases, the difficulty in reaching an accurate diagnosis in a reasonable time is at the top of the list. Firstly, and too often, the diagnosis represents the biggest challenge. Because these diseases being rare, they may be difficult to diagnose. Many of these share symptoms with more common liver conditions, which can make it difficult for doctors to identify them. And because of the limited awareness of these conditions and the scarcity of centers with adequate clinical experience and laboratory skills, very important, then diagnosis is difficult to achieve and is often delayed. This leads to delayed treatment, which can worsen outcomes for patients. Secondly, if not properly diagnosed and treated, they can cause serious and sometimes life-threatening complications. In some cases, these diseases can lead to liver failure, which can be fatal without a liver transplant. And finally, because rare liver diseases affect a small number of people, there may be limited resources and funding available for research and treatment development. Research into rare liver diseases can help to uncover new insights into liver function and disease pathology, which can inform the development of new treatments and therapies for both rare and common liver conditions. So raising awareness of these diseases is essential to ensure that they receive the attention and resources needed to improve outcomes and quality care for the patients.
Thank you.
Thank you.
Tell me something. How do you foresee the future of patients affected by autoimmune hepatitis? What do you see in their future? How do you think things will develop? If there will be something that will be a cure? What do you think? And more in general, the future of liver patients in general.
The future. Well, I tell you this, to my opinion, the future, to my opinion, first of all, rare liver patients are in disadvantage for various reasons, like I mentioned before, delayed diagnosis, limited treatment options, lack of specialized centers. And the future of liver patient is likely to be shaped by advancements in research, medical technology, and treatments. As our understanding of liver diseases improves, we may be able to provide better, more personalized care to liver patients and improve outcomes. This is the final end. Although not an expert in hematology, I can mention here a few examples of how liver patients may benefit in the future. First, improved diagnostics. As research into liver diseases continues, there may be new and improved ways to diagnose liver diseases at an earlier stage. This could lead to earlier treatment and better outcomes for patients. Second, non-invasive treatments. Currently, many liver diseases are monitored and treated with invasive procedures such as liver biopsies and liver transplants. In the future, there may be new and less invasive treatments available, such as medications or gene therapies. Third is personalized medicine. Advances in genetic testing and precision medicine may allow doctors to tailor treatments to individual patients based on their unique genetic makeup and disease characteristics. This could lead to targeted and more effective treatments with fewer side effects. And fourth and final, artificial liver support. Researchers are currently developing artificial liver support systems that could provide temporary support for patients with acute liver deficiency failure while they await a liver transplant. In the future, and hopefully, these systems may be more widely available and might provide a safer alternative to traditional liver transplants.
Sounds wonderful. It sounds like there's a lot of hope in the future also. I really believe that. And I'm happy to hear you saying that as well.
As I said before, really, I mean that patients with rare diseases and liver diseases particularly are really disadvantaged.
But I think there is hope in the future, if I'm correct. That's
We
what
are
we have to
waiting.
believe, right?
We have to raise the awareness. This is the
Yeah. This is what we're trying
this is
to
too
do.
important.
Exactly.
That's what we do. That's what we do.
Exactly. Anyway,
All
all
right.
I can say is thank you very much for giving us your time, and wishing you a lot of health in the future too, and hoping that there'll be a cure for autoimmune hepatitis, that will be a cure and not just a treatment one day soon, and everything else as well. Wishing you all the best. Thank you.
Thank you. Wish all the best also to you, and thank you very much again for this interview and providing with these questions so I could open up and say what I think. And in the future, we wait and see what will go on. Thank you.
Thank you. Have a good day and a great weekend. Bye-bye.
Bye.